Stimulants, addiction, and safety. Oh my. Hi, I'm Dr. Keelan O'Connell, a board-certified child, adolescent, and adult psychiatrist. Welcome to my channel. Today, I'm answering some of the most common questions about treating childhood ADHD with stimulant medication. Things like, won't my child get addicted? And aren't these medications dangerous? First and foremost, when prescribed and monitored by a clinician, ADHD medications, including stimulants, are among the most studied effective treatments in child psychiatry, with large improvements in attention and impulse control for most kids. I am not kidding when I say that working with a family to discover the optimal ADHD medication to treat a child's symptoms is one of the most rewarding parts of my job. While other medications in behavioral health generally take several weeks to see any meaningful effects, a child with diagnosed ADHD who's put on the right stimulant medication for ADHD symptoms will experience significant improvements in their symptoms the same day they start the medication. When this happens, I cannot tell you how many parents, teachers, coaches, and even children say, "Wow, I really wish I'd started this medication sooner. It's made such a big difference." ADHD medications are effective and powerful. Let's not forget what Uncle Ben once wisely told Spider-Man. With great power comes great responsibility. In the case of powerfully effective ADHD medications, there are some risks that we need to be aware of, but that does not mean that they can't be safely used to treat ADHD symptoms across the lifespan. So let's address some of the common concerns about the safety of stimulant use, especially in kids. Stimulants can be misused if taken in higher than therapeutic doses, if they're mixed with other substances, or if they're shared or sold for recreational use. Because of that risk, the government puts them in a special category called controlled substances. Controlled doesn't mean bad or dangerous. It just means that extra rules are placed around prescribing them as safeguards to help prevent misuse and to keep people safe. To reduce these risks of misuse or diversion, it's important to securely store medication, to never share medication, and to use long-acting formulations when appropriate. For young children, it's also important for caregivers to maintain the possession of the medication to reduce the likelihood of its being lost or stolen. Now let's address another major concern for parents when discussing stimulant use in children. Won't my child get addicted to these medications? Taking ADHD medication is prescribed, and needing it to manage ADHD is not addiction. Addiction involves compulsive use despite harm, cravings, and loss of control. When used correctly, stimulants are among the most effective ADHD treatments. Decades of research, including meta-analyses and large follow-ups, show that proper stimulant treatment does not increase the risk of later substance use disorder. Some studies even suggest protective associations with prescribed stimulant use for ADHD treatment with reduced risks of smoking and other illegal behaviors. The bottom line is this: properly prescribed stimulants have strong evidence for not making kids addicted. The real risks rise with untreated ADHD and misuse, which we can prevent with monitoring, safe storage, and education. See you on my next video.